The tests I'm about to do are the tests for the shoulder that require your patient to be in supine. So the first one is the apprehension test, where you just take your patient and you have you slide a little more this way too. Oh yes. And you get them into abduction and external rotation, and you are watching their face for an apprehensive look that would indicate that they have some anterior shoulder instability. And then from there, you can keep them in external rotation, and you are going to do the Jobe Sublux relocation test, where you apply a subluxing anterior force, and then you're going to relocate. And a positive test for this would have to be indicated by pain upon the subluxation and relievance of that pain upon relocation. And depending on where it is, you can be talking anterior microinstability or internal impingement syndrome of the posterior capsule. And then you'll move into the glide at 0 degrees. Patient is horizontally adducted and shoulders flexed. And you're going to apply a posterior force, feeling for clicking or any sort of pain that would indicate a posterior capsule instability. And then the jerk test, you're just going to compress that shoulder in and bring it across their body. Pain, clicking, anything like that is posterior shoulder instability. And then you can do the same test at 90, where you pin their hand in your armpit, and you're going to apply that posterior force once again, checking for excessive translation, pain, clicking. That would be posterior capsule instability. All right, and then from there we move on to the Clunk test, right? And so the Clunk test is done. Get them in that external rotation, and you rest their arm in your arm. Grab as close to the joint as you can up here, and you're just scouring that glenoid labrum with the humeral head, and you're looking for pain, clicking, clunking, and you can detect slaps or Bankarts with this. And then you move on to Clunk II, and you are just applying you're kind of making a fulcrum here, right? And when you press down with your distal hand, you're going to push up with your proximal hand, and this sort of creates a lever that pushes the glenoid, or pushes the humeral head up into the glenoid fossa, and you can detect, once again, Bankarts or slaps. And at the very top up here, and you can go right into the very top, you can go into the crank test. Hold them up here, and you internally rotate them, testing for slap lesions with clicking, pain, or apprehension. And those are all the tests for the shoulder, lying down.